Welcome to Innovate Training. My name is Carol Peugeot, and I'm your instructor for this course. This is Understanding HIPAA for the Medical Office, and this is the second part to the security rule and our fourth lesson. In part one, we talked about the administrative safeguards. In this lesson, we're going to talk more about the physical and technological safeguards. So what are we going to go over today? Well, first we're going to talk about the difference between administrative safeguards and physical safeguards. Then we'll describe the definition of workstation access and how this definition helps to limit unauthorized access. And then we'll talk about several ways technical safeguards can keep patients' information confidential. Physical and technical safeguards are the actual techniques, the equipment, and the security that will help to maintain the integrity of health information. In other words, it's the practical application of the security rules or the security rule requirements. While policies are important, they will not be helpful unless the provider actually takes the steps to ensure the electronic protected health information is kept secure. So what are physical safeguards? This deals with the equipment and the physical storage and maintenance of electronic protected health information. Items required under the physical safeguards for security cover four areas. Number 1, facility access controls. Number 2, workstation location and access. Number 3, workstation security, in other words, software. And number 4, device and media control. Let's talk about facility access controls. This deals with the gaining entry to areas where electronic protected health information is stored. It also deals with the access to where computer hardware is located. This includes things such as locks and keys. These type of facilities or these type of controls helps to limit the access to only those who are employed in the information technology department or to the management personnel. Specifics to be addressed. The security officer must document how his or her organization is addressing physical access. These 4 specifics must be addressed: disaster recovery and business continuity, how will the business operation continue in the event of a disaster, emergency mode operation, such as power outages, facility security plan, and procedures for verifying access authorizations before any access is permitted. So let's talk about a contingency plan. This is a data backup plan in the event of malicious tampering or loss of data due to unforeseen events. A disaster recovery plan, such as fire, earthquake, flood, etc. We talked about Hurricane Katrina and what happened when records were lost in our last lesson. Emergency mode operation plans. How will data be preserved in the event of a power outage? Computer access. This is access to computer systems that is limited only to those workers who need to administer and maintain the electronic systems where electronic protected health information is stored. Limiting access should involve keeping doors locked and using keys and electronic locks. Maintaining a physical safeguard checklist should include questions such as: who is allowed access to the building? Are closed circuit cameras recording? Are the doors manual or are they electric? Can access be gained from a loading dock or a garage? How do visitors gain access to the building? Are business visitors escorted at all times? Do outside vendors have access to electronic protected health information either directly or incidentally? Business visitors. Business visitors other than patients and their guests. This refers to those who may enter parts of the building, such as UPS personnel, salespeople, inspectors, or other types of delivery personnel. 99% of unauthorized access will be incidental. In other words, a casual glimpse of an open file on a computer screen is an example. Security can start with a simple act of turning off a computer screen or closing a file. Limiting exposure. Business visitors must be monitored to prevent incidental exposure to patients' electronic protected health information, such as I mentioned earlier, shutting off the computer screen, or logging out of a patient's account while the visitor is on the premises. and do not post passwords or usernames by your workspace, such as a little cheat sheet by your computer. A workstation. This is an electronic computing device such as a desktop computer, a personal data assistant, a tablet, or a laptop. These all would be considered a workstation. It is important that they all have automatic log-on and log-off feature, as well as a time delay at a minimum of 10 minutes, where the workstation or the device would automatically shut off after 10 minutes or less. Workstation security. Each person on the workforce should understand the Internet use policy as well as the email policy of that entity. Using the Internet to conduct personal business leaves the entity at risk. Equipment at the covered entity is to be used for business and not for personal use. So here are some questions to ask when dealing with workstation security. Does the workstation or does the workforce understand how to lock their computer screens? Are passwords, tokens, or biometrics used to secure workstations? Can workstation screens be viewed by people walking by? Is any electronic protected health information stored on a workstation or user device that is located outside the entity, such as someone's laptop or tablet? What is a remote workforce security? Or how does that pertain to entity security? Any employee who works from home or works on the road must have the same security protections as those employees working on site. Since off-site locations pose a high risk, these locations must be monitored. Any security incidents must be reported and procedures must be followed, as well as documented. So let's talk about technological safeguards. This is the technology and policies and procedures for its use that protect electronic protected health information and control its access. There are several areas relating to infrastructure that need to be in place in order to ensure the security of electronic protected health information. What is an infrastructure? Well, that is the computer server, the hubs, the switches, the connecting wires, the terminals, and the desk units that contain or that are used in storing electronic protected health information. And there are several technological safeguard issues that the security officer must address. That includes access controls, audit controls, integrity of electronic protected health information, persons or entity authentications, and then transmission security. So let's first talk about access controls. This prevents unauthorized people from entering the information technology systems. Several methods to regulate access include a personal identification number or PIN, a password system, a biometric identification system such as a fingerprint or iris scan, or a telephone callback system to verify the user who's trying to gain access. Passwords should not be easily guessed. Using pet names, names of children, birthday, or spouses can be easily guessed. It currently takes a hacker less than 1 minute to guess any combination of 4 characters. It takes several hours for a hacker to guess any combination of 5 characters. And it takes a hacker several weeks to guess any combination of 6 characters. So you see that the more characters a password has in it, the more secure it is. Transmission security. The security rule requires protection of health information that is being transmitted. Data must be protected in a manner corresponding to the associated risk. So what is encryption? What encryption is, it changes readable text into a series of garbled characters using a complex mathematical algorithm. This is a step-by-step procedure for solving a particular problem. Encrypted data. Once encrypted, data can be transmitted over unsecure lines. However, Because older codes can be easily broken, encryption technology needs to be reevaluated on a routine basis. Compliance challenges. The Department of Health and Human Services has written security rules in a manner to apply to any size organization. The Department of Health and Human Services understands that it is impossible to keep electronic protected health information totally secure. The goal is to see documentation that the covered entity, regardless of size, has taken steps to ensure security and the safety of electronic protected health information. A rule of thumb is to provide reasonable and appropriate security for a particular situation. So in summary, the HIPAA security rule covers any protected health information that is in electronic form. This may be information that is transmitted or at rest in an on-site or off-site facility, such as a backup system would be. HIPAA requires that a reasonable amount of security and procedures be taken to ensure the security of electronic protected health information. Well, I hope you enjoyed this lecture. Please contact me with any questions or comments. Remember, you can contact me at innovatetraining@gmail.com. And please be sure to take the assessment quiz at the end of this lecture to better prepare you for the HIPAA exam. I will see you next lesson. We're going to talk about transactions and code sets. So until the next lesson, we'll see you then.